So let's discuss the anatomy of the cervical vertebral body. Some points about all the vertebral bodies so that it will help us to discuss the arthritis later. Now, the first thing that we need to know is that there are a total of 33 vertebral bodies. So there are a total of 33 vertebral bodies, 7 cervical vertebral bodies, then we have 12 thoracic vertebral bodies, 5 lumbar vertebral bodies, 5 fused sacral vertebral bodies, and some 4 to 5 coccygeal vertebral bodies which are fused from one coccyx. Now there are 8 cervical now, and then there is 12 thoracic now, and 5 lumbar and 5 sacral and so on. Now when there are 8 cervical now and the 7th vertebral bodies, now if this is C1 vertebral body, C2 vertebral body, C3 vertebral body, the first nerve, the C1, the first cranial nerve comes above the C1 vertebral body, and the second nerve comes below the vertebral. So this is the first cervical nerve, second cervical nerve, and then it keeps on happening that way. Multiple nerves come out till the C7 vertebral body. All the nerves will come above the vertebral body, but when it comes to the C7, there is no C8 vertebral body. So the C8, the 8th cranial nerve comes below the C7, and the first thoracic nerve comes below the thoracic vertebral body. So till the C7 vertebral body, all the cranial nerve comes above the level of the vertebral body. But from below the C7, the cranial nerve starts coming below the level of the vertebral body, including the 8th cranial nerve comes below the C7, first thoracic nerve comes below the first thoracic vertebral body. Again, I have told 7 cervical, 12 thoracic, 5 lumbar, 5 fused sacral, 4 to 5 coccygeal vertebral bodies, and corresponding nerves come above the level of the vertebral bodies till the C7 vertebral body. After that, it comes below the level of the vertebral bodies. Now there are some basic differences between the cervical vertebral body from the thoracic and the lumbar vertebral bodies, and we know that sacral is fused vertebral body, coccygeal is fused vertebral body. The cervical, thoracic and lumbar are not fused vertebral bodies. Each vertebral body is made up of a body and then a dorsal arch, and the dorsal arch is made up of pedicle. Posterolaterally there is pedicle, and the pedicle joins with the lamina, and the lamina is fused with the extension called as the spinous process. This is the spinous process, and the point where the meeting of the pedicle and the lamina, there is a transverse process coming out called as the transverse process of the vertebral body. Now we have one vertebral body, two pedicle, two lamina, one spinous process, two transverse process, and also there will be 4 articular facets. So if this is a vertebral body and this is the pedicle and lamina, this is the transverse process, there will be 1 articular facet superiorly, 1 articular facet inferiorly on either side. There will be 1 superiorly, 1 inferiorly on either side. So there are total of the 4 articular facets. So 4 articular facets each vertebral body contains. Now one of the basic difference between all these, in the cervical level, the vertebral bodies are slightly smaller compared to the cervical canal, whereas in case of the thoracic level, the spinal canal is smaller. Even in case of the lumbar level, the spinal canal is slightly smaller. And the other difference that we need to know is the shape of the vertebral body. In the cervical are more thin and small, whereas the thoracic are having the heart-shaped vertebral bodies, whereas the lumbar are having flat posterior surface, not the heart-shaped. The third difference that we need to know is how the spinous processes are present in each of this. The spinous processes are, in case of the cervical, they are slightly smaller and they are having the bifid posterior end. There are bifid posterior end, having 2 points, whereas the thoracic are having thin, but it is more vertically oriented, whereas the cervical is more horizontally. The lumbar is having a broad vertebral, the spinous process, the broad spinous process. The other difference that we have to see is the transverse process. The transverse process of the cervical vertebral body will have the canal in it through which the vertebral artery passes. The vertebral artery passes from the C7 vertebral body, goes to C5, 6, 5, 4, 3, 2, 1, and then comes out of the it goes inside the foramen magnum, then enters into the brain. So that's how it supplies the brain. The posterior circulation of the brain is mainly by the vertebral artery. Now from the C7, the transverse process, there is a foramen through which the vertebral artery passes. So all the cervical vertebral bodies have it is C6 vertebral body onwards. The vertebral artery passes through the transverse process. There is a foramen in the transverse process. Now there is also this foramen seen in the C7 vertebral body because the vertebral vein passes through it. It drains the blood from the brain and it passes even in the C7 vertebral body. So the foramen is there in the C7 vertebral body as well, but it will be slightly smaller because only one vein passes through it. So this is the transverse process of the cervical. The other thing that we need to know is the transverse process of the thoracic. Now there are transverse process of the thoracic. Now what happens in the thoracic level is that in the thoracic level there is the ribs. Now each rib will have a head. And from the head it will come down forming the neck, and this neck will continue anterior as the body of the rib. Now this head will make the articulation with the vertebral body, and the neck will make the articulation with the transverse process. So there is one articulation with the transverse process and one articulation with the body of the vertebrae, and the two articular facets are present in each vertebral body. And other important thing is now each rib. Now if there is the T1 and this is the T2, this is the second rib will be originating, the head of the second rib will be present here, such that it will have an articular surface with the superior vertebral body as well as the corresponding vertebral body, and then it goes backwards making an articulation with the transverse process of the corresponding vertebral body, and then it goes front and forms the body of the rib. So the articulation of each rib, for example, the second rib has an articulation with the first thoracic vertebra and the second thoracic vertebra and the transverse process of the second thoracic vertebra, whereas in the first rib, that's the only difference with the first rib has articulation with the first thoracic vertebra, then the transverse process, and then goes front. So it doesn't have, the head is not articulating with the two vertebral bodies. That's the only important point here. So that are the specific points here. So this is an example of the cervical vertebral body. So this is the body of the cervical vertebra. So this is the pedicle. What we are seeing here is a pedicle arising from the posterior lateral aspect of the body, which continues as a lamina posteriorly. So these are the lamina, and then it is forming the spinous process at the meeting point of the two lamina, and it is a bifid structure. Then we have a transverse process, which is small, but it has a vertebral foramen within, and we have a superior articular facet. If we go below, we have an inferior articular facet. That's one of the difference between the cervical and other vertebral bodies, is that the cervical facets are slightly horizontally placed. That is superior inferior facet it is. It is the facets are placed more flat and facing upwards and downwards. So this is the superior facet, and the inferior facet will be facing downwards and fusing like this. Whereas when I come more towards the thoracic vertebra, the facets become more and more vertical, and it will be having the posterior, the superior facet will be facing posterior, and anterior, the inferior facet will be facing anterior. So I'm almost antero-posterior orientation. And as I come more and more towards the lumbar, it becomes more and more oblique, and it becomes mediolateral oriented. So lumbar vertebral bodies, the superior facets are facing medially, inferior facets are facing laterally, and the joint is zygoapophyseal joint is formed like that. So that's the difference. So we are seeing this is more vertically, horizontally oriented facet here. So that's one more difference. So main thing that you have to see is the size of the foramen. Large foramen compared to that of the vertebral body, almost same size. The spinal canal, so not foramen, the spinal canal is almost the same size of that of the vertebral body. If you see the next image, the same thing is shown here. The vertebral body the large spinal canal, there is a vertebral canal, the transverse process, and usually they have two tubercles through which a lot of muscles of the neck are attaching. And then we have the lamina, then we have the articular facets, then we have the spinous process, bifid ribs. So this is the classical image of a cervical vertebral body. Now this is a thoracic vertebral body. As I told, it is having usually heart shape, concave posterior surface. It's having a heart shape, and then we have here one articular facet for the head of the rib, one articular facet in the transverse process for the neck of the rib. And then we have the superior articular facet, one more articular facet is here, inferior articular facet. Now this is more posteriorly facing superior articular facet and anteriorly facing inferior articular facet. So we are not seeing the inferior articular facet. The spinous process are more thin, and it is more obliquely placed, vertically placed. It is facing downwards. If I see the vertebral body, the spinous process is thin, and it is facing downwards. So that's the other difference is, see how small the spinal canal compared to that of vertebral body. The same thing is shown here. This is a large vertebral body, heart-shaped vertebral body, small spinal canal compared to the size of the vertebral body, articular surface of the head of the rib with the body, and the transverse process articulates with the neck somewhere here, not seen in this section. And see, at the same level, you're not able to see the spinous process like we saw in the cervical. It goes slightly downwards. Now this is the lumbar vertebral body. As I told, it's more a straight posterior surface with the rounded anterior surface, and see how it is facing. The articular surfaces are facing the medially, and we have the transverse process, and we have this, I told, the broad shaped the spinous process. The other thing that we see here is, here in this image we can see the zygoapophyseal joint. That is the joint between the inferior articular facet. What we are seeing, this is the inferior articular facet. This is the inferior articular facet, and we have the superior articular facet. I told lumbar it will be more facing medial and lateral. See how this is the superior facet. We can see the posterior aspect of it. So because it is facing medially, whereas the inferior articular facet is facing outwards, so it is facing outwards. So this is the inferior articular, the superior articular facet. It is having mediolateral orientation. And also see here, this is the superior articular facet of the same vertebral body. So this one vertebral body, this vertebral body, this is the inferior articular facet, this is a superior articular facet of the same vertebral body, and this is connected by this this structure. This is called as pars interarticularis. This is called as pars interarticularis. The translational force from the one vertebral body is taken to the other vertebral body through this pars interarticularis. Sometimes there will be a fracture in this, which will lead to anterolisthesis of the superior vertebral body over the inferior vertebral body because of the loss of the transmission of the translational force to the next vertebral body. So this is a new structure that we saw. So we know that from the vertebral body, the posterior lateral, the structure is called as a pedicle. Then it forms the lamina somewhere there. In between, the structure is called as pars interarticularis. So this is the pedicle. So this is the lamina. So this is the superior facet. There is the inferior facet. So this structure which connects the superior facet, inferior facet, so lamina and pedicle, all these are connected through this structure called as a pars interarticularis. Okay, so that's about the lumbar vertebral body. Now, very important structure that we need to know about arthritis is the craniovertebral junction, which is made up of the there is a foramen magnum, which is a foramen which is present in the occipital bone. And the posterior surface of this is called as the opistheon, and the anterior is called as the basion. The anterior bone is called as the basion, and posterior bone is called as the opistheon. And basion is a tip of the clivus. The tip of the slopy surface called as a clivus is called as a basion. Now the basion is a part, these are the part of so the bones that are involved here are, one is the occipital bone, one is the atlas, and one is the axis. Atlas is nothing but the C1 vertebral body and axis is nothing but the C2 vertebral body. So these are the bones which are taking part in the craniovertebral junction. Now anteriorly, what we are seeing here is the arch of the C1 atlas, the C1 vertebral body, also called as atlas, and the posteriorly it is the arch of the atlas. So normally we see a vertebral body from which the pedicle, then we have a lamina, and then there is a spinous process and the transverse process. This is how normally any vertebral body is present. So this structure together we used to call as the dorsal arch. Now in case of the C1 vertebral body, this is any vertebral body, C1 vertebral body, what difference that we see is there is a dorsal arch and there is also a ventral arch. So there is a dorsal arch, there is a ventral arch, there is a transverse process, there is a small spinous process, but there is no vertebral body. So it is a large structure. It's a large structure. Now very important is that there is a process called as odontoid process of dens, which is a part of the second vertebral body. So we have a arch with a ventral arch and the dorsal arch, but there is no body in the C1. This is the C1 vertebral body, this is the C2. Now the C2 will have a projection upwards called as odontoid process of dens, and this will form a joint, medial atlantoaxial joint. This is called as atlas, this is called as axis. The joint is called as the atlantoaxial joint. The medial atlantoaxial joint is between the dens and the ventral arch. Now this arch is forming in the midline and it is held together by a ligament here called as a transverse ligament, which is going from the one end of the arch to the other end of the atlas, and it is keeping the odontoid in place, the medial atlantoaxial joint in place. The lateral atlantoaxial joint is nothing but the facet joint, which is forming between the facets of the atlas and the axis. It is a zygo-apophyseal joint like we see in any other vertebral bodies. So this is the medial atlantoaxial joint like how we see here. So this structure here is nothing but the C1 ventral arch of the C1. This is nothing but the dorsal arch of the C1. Now what we are seeing here is the vertebral body of the C2, and this structure here is the dens, the odontoid process, the dens odontoid process of dens of the C2 vertebral body, which is forming a joint here, and that is the medial atlantoaxial joint. Now there are some important ligaments which are running across. Now which is the most common ligament that we all know is from the C2, a ligament runs downwards called as posterior longitudinal ligament. Anteriorly we have the anterior longitudinal ligament. Now there is also a ligament which is coming from the occipital bone to the ventral arch. It is called as the anterior atlanto-occipital membrane, anterior atlanto-occipital membrane. Also we have posteriorly the posterior atlantoaxial membrane extending from the opposition till the dorsal arch. So we know now the anterior longitudinal ligament, posterior longitudinal ligament, anterior atlanto-occipital membrane, posterior atlanto-occipital membrane. Also see here there is a ligament going from the tip of the dens to the basion. This is called as apical ligament. It's called as the apical ligament. So we know now there is an apical ligament anterior. So if you come starting from the anterior, so anterior atlanto-occipital ligament, then there is ligament of dens. You can see this is nothing but the transverse ligament, which is holding the dens to the anterior arch of the atlas. So this is called as transverse ligament. From the transverse ligament, so in this section we can see this is the transverse ligament from which extension goes upwards called as cruciate ligament, and downwards again called as cruciate ligament. Is a ligament going upwards and downwards is called as a cruciate ligament, which is attaching the transverse process to the occipital bone and to the C2 vertebral body. So this is the cruciate ligament, is an extension of the transverse ligament. Then there is a ligament extending here. This is called as the tectorial membrane. There is a posterior to the cruciate and the transverse ligament. A ligament attaches from the basion. It goes all the way till the C2 vertebral body, above the posterior to the cruciate ligament and the transverse ligament. That is called as the tectorial membrane, which is again keeping the atlantoaxial, the medial atlantoaxial joint in position. So these are the ligaments which are keeping the joints in position, and these are the bones, and this is the overall structure of the craniovertebral junction. There is no intervertebral disc between the C1 and C2 vertebral bodies. So in this image, what we can see is, we can see the inferior articular facet, we can see the superior articular facet, and this inferior articular facet continuing upwards, and here it is forming the superior articular facet. Here there is a transverse process. This is slightly obliquely placed vertebral body. So this is the superior articular facet, this is the transverse process, and this is the inferior articular facet, and this is the spinous process, and then again we have the transverse process on the other side. So this will form the Scottish dog appearance, with the face of the Scottish dog formed by the transverse process. Then the ears are formed by the superior articular facet, and this part is called as the neck of the Scottish dog, is formed by the pars interarticularis. As I told, it's a continuation of the superior articular facet with the inferior. So this is called as pars interarticularis, which forms the neck of the Scottish dog. This is exactly what we see here. So this is superior articular facet, inferior articular facet. Inferior articular facet forms the foot of the dog. So this is the face of the dog, the ear of the dog. So this is the neck. So this neck is formed by the pars interarticularis. When there is fracture in this neck, it will lead to the instability, and that's when we see the discontinuation in the Scottish dog. Will have a collar, a hypolucency is seen at the level of the neck, which is nothing but the fracture. Sometimes there will be a gap at this level, which is seen when there is displacement after a fracture. If there is only fracture, we see a lucency, that is a Scottish dog with the collar, and then if there is a displacement, we'll see something called as beheaded Scottish dog. That is where there is a displacement and there is a spondylolisthesis. Now each vertebral body and the spinous process, all these are attached together by the ligaments. As I told previously, there is anterior longitudinal ligament attaching the anterior surface of the vertebral bodies, and there is posterior longitudinal ligament attaching the posterior surface of the vertebral bodies, and the lamina are attached to each other by a ligament called ligamentum flavum, and two spinous processes are attached by a ligament called as interspinous ligament, and on top of each spinous process there is a ligament called as the supraspinous ligament. So these are the ligaments which are holding together all the vertebral bodies, and between two vertebral bodies we have the intervertebral disc. So these are the structures which are holding the vertebral bodies together, and each vertebral body contains a spinal cord, and this spinal cord is surrounded by a pial membrane, a membrane which is inherent attached to this spinal cord is a pial membrane. And after the pial membrane there is a space which is filled with the CSF, that is called a subarachnoid space, and after that the membrane is called as the arachnoid membrane. What we are seeing here is arachnoid membrane, and outside the arachnoid membrane is the dura mater, and this dura mater is attached to the periosteum. It will be touching the periosteum and stuck to the periosteum, and this arachnoid and the dura mater sometimes extends along the peripheral nerves, forming a sheath around it. So these are the covering of the spinal cord is by the arachnoid, but is attached to it, sticking to it, and outside that there is a fluid filled space formed by the subarachnoid space, and outside that there is a arachnoid covering which is holding the fluid inside, and outside that touching it is the dura mater, which is also having its attachment to the periosteum. And also the arterial supply of the spinal cord is by a central anterior single anterior spinal artery and two posterior spinal artery. These are the branches which are coming from the vertebrobasilar system, and then all these arteries will be getting some collaterals from the thoracic level, from the abdomen, from the descending thoracic aorta. So these are the branches which are supplying the spinal arteries, called as artery of Adam Kivis, which are supplying these vessels, which are giving collaterals to the anterior and posterior spinal arteries, the artery of Adam Kivis. So that's some of the collaterals in the spinal artery. So it's the same thing again. We are showing the anterior spinal artery, and there are two posterior spinal arteries which are getting collaterals from the vessels which are supplying the vertebral bodies, and these vessels which are coming from the descending thoracic aorta are called as artery of Adam Kivis.